Now, there are some diseases that are related to these channels. So, Parkinson's disease. What is Parkinson's disease? Actually, it is named on a person's name, Parkinson. He was a scientist. So, actually, there is a part of a brain which is known as midbrain, and in the midbrain, substantia nigra is a part which produces dopamine. So in this disease, the substantia nigra is affected and it can't produce dopamine. And at that part, neurons are degenerated. So it mainly occurs due to mutation of a gene, which is known as prion protein gene. Means the actual protein converts into prions, and prions are defined as the misfolded proteins. And also, when the neuron degenerates, it it actually degenerates due to channels. When in potassium, the selectivity filter stops work, and in calcium, the activation gate stops work, and in sodium, the inactivation gate stops work. So when this occurs, and dopamine is not released in the body, and actually dopamine is a hormone which releases stress and make feel us happy, and also other associated problems comes with it is the neurons degenerates, and it goes from one neuron to another neuron by transfer of the prion proteins. So at first, the symptoms appears, the smell disappears, patient can't smell, and tremors occur. Tremors in Parkinson mainly means the involuntary and rhythmic shaking of hands. So after this, the muscle stiffness occurs at the time of attack, and tremor occurs at the time of attack. These two things occurs, and with that, delusions, depression, anxiety, dementia, etc. Because dementia means loss of memory, and delusion means making ideas in your brain that you feel is real. So for its treatment, we mainly use levodopa, which crosses blood-brain barrier and converts into dopamine there by an enzyme which is present there, and we use levodopa in our drugs. Now, myopathy. What is myopathy? Myo means muscles and pathy means suffering. Suffering mainly we say disease. So muscle diseases are also known as myopathies. So muscle diseases and neuropathies or neurotemesis, axontemesis, these are different things. These are not from the side of neurons. Myopathy is actually the muscle fiber malfunction, and neuropathy is related to neurons, or neurotemesis or axontemesis. They are related to neurons, and myopathy is strictly related to muscles. So then it has two types: inherited or acquired. It is mainly genetic, so it is may be inherited, or it may be inherited, or it may be acquired by some mutations. So myopathy converts into channelopathy. Channelopathy means channel, and pathy means disease and suffering. So when the channels are suffering, channels are not working. So this is known as channelopathy. So in channelopathy, mainly mutations occurs in the genes, and as the result, the channel doesn't work properly. So there are two types of channelopathy: myotonia and periodic paralysis. In myotonia, the muscle doesn't relaxes. Myo and tone. So the muscle contracts, and after contraction, it doesn't relaxes. And periodic paralysis, it is a specific type of paralysis which comes after periods, some interval of time. So in this, the contraction doesn't occur. In periodic paralysis, calcium and sodium channels are mutated, and myotonia, chlorine, and sodium channels are mutated. Means sodium is involved in both, and chlorine is only involved in myotonia, calcium is only involved in periodic paralysis. Now, another is hyperkalemia. Hyper means more and kalemia means potassium. Don't be confused in hyperkalemia and hypercalcemia. Calcemia is related to calcium and kalemia is related to potassium. So it is mainly caused by kidney issues or eating more potassium in diet. Kidney issues, for example, kidney is not filtering properly or potassium is not excreted out properly from the body. So it gets stored in the blood and it causes hyperkalemia. And also it is caused by cellular injury. As we know that potassium is more inside the cell. So when cellular injury occurs more rapidly, so the automatically the blood potassium level increases. And if the hemolysis is more, as it is more in polycythemia. So when polycythemia occurs, hemolysis occurs more. So as a result, the blood potassium level increases because liver gets everything into the blood. Liver puts everything into the blood. And also some medications having more potassium. So if we use them daily basis and in much more amount and for longer duration, so it also causes hyperkalemia. Hyperkalemia also causes hyperparathyroidism, and due to hyperparathyroidism, calcium level also increases in blood. Means calcium comes from bones to the blood, and also bone related diseases occurs, and hypercalcemia also occurs. And also inactivate sodium channels for much more longer period of time, which can't be regained again. As cell membrane is permeable to potassium at resting state, so when the potassium increases in blood, it diffuses into the cell, and also cell get more potassium. And as potassium is positive charged, so the cell inside gets less negative, means it is minus 70 normally, so it comes to 60 or 65, minus 65. So 60 minus 65 or minus 55, it is near the threshold. So these voltage sensors are repelled slowly, not fastly, because it is every time near the threshold. So it repels them slowly and inactivation gate closes. And as it is near to the threshold every time, so they can't regain, and means they can't get back to their original position to close the activation gate and open the inactivation gate. And like this, some of sodium channels stop work and the cell is not depolarized again. And in severe cases, it may cause death. And also as a result, it causes prolonged immobility. And in some cases, it causes slow electrical conductivity, means the electrical conduction slows down due to inactivation of some sodium channels, not all, some. And if all blocks, so it causes prolonged immobility. Also, it causes dilation, means as there is no contraction, so the muscles will be very relaxed and will be at last dilated. And we can also say that as more potassium will accumulate into it, so it will cause dilation of muscles. So we covered this: prolonged immobility, dilation, slow electrical conductivity. And also due to this, muscles get weak, so muscle weakness occurs, and bradycardia and chest pain, means it also affects heart muscles. Heart muscles are also a type of muscles. So it causes bradycardia and chest pain due to less contraction, and the body doesn't get the appropriate nutrient or oxygen. So it causes bradycardia due to less contraction and chest pain due to less nutrient supply to body or less oxygen supply to body. And also it affects smooth muscles, GIT, urinary, etc. So it causes GIT pain, means abdominal pain, and also causes respiratory disorders, means lungs are also their smooth muscles, so it also causes respiratory distress and the person can't breathe properly. And also it causes paresthesia. Paresthesia are abnormal sensations. It is numbness and pin and needle-like sensations on the skin, and it mainly occurs in lips, on the palm of the hand, and lower side of the foot. And due to GID, it also causes vomiting, nausea, and diarrhea, etc. As the smooth muscles of the large intestine and small intestine doesn't contract properly, so it causes diarrhea. And vomiting means muscles of stomach can't contract properly, and as we have cardiac sphincter there, so cardiac sphincter is also not contracting properly, so it causes antiperistalsis, means vomiting. And nausea is caused by improper contraction of stomach. Then its treatment is to decrease potassium from blood. So first we have to define its cause. What's the cause? After that we will have to get treatment. If the cause is kidney disease, so means kidney failure, etc. So we will filter out the blood. In that case, we will filter out the blood, and potassium will decrease in the blood. We can simply do it by dialysis, which have two types, hemolytic and peritoneal. Also, we can transplant kidney. And if it is caused by needing so much potassium, so we will manage that. Or it is caused by medications, so we will not prefer that medications. Instead of that, we can use other medications. And in hemolysis, we will treat polycythemia.